Hello, everyone. Thank you to those who have joined us today. I'm just going to give it another minute or so to allow a few more folks to sign in. Hi, everyone. Thanks for joining. I'm just going to give it another minute or so to allow people to sign in.
Hi, Tiff.
All right, I think we can go ahead and get started. I just want to say thank you so much for joining today's webinar. My name is Tracy Stefik. I am the Senior Director for National Coordination and Safe Communities here at the SAFE Project, and I'm also going to be your moderator for today's webinar. Before we begin, I just want to address one minor logistical request, and that's just to make sure we're covering today's content in the 60 minutes that's allotted. If you have a question, can you please just hold questions off until the end of the presentation? We'll have time at the end to address those. And also feel free to put those into the chat box and we can address those there as well. So let's go ahead and get started. Next slide, please. Thanks for joining us for the sneak peek of our new program called Bridging Prevention and Recovery. We often refer to this as BPR. The program was developed by our SAFE Project Executive Director, Brandy Izquierdo, and Sarah Potter, the Director of Prevention. You might have seen their presentation on this new program this past February at SAMHSA's National Prevention Day, and here we're now excited to share that with all of you and launch our first community cohort. And this is a real new and innovative program that we're excited to share with you today. So if you know anyone that's in your network and surrounding communities to you that might also be interested in this new program, we're holding a second sneak peek tomorrow, Friday at 1:00 p.m. Eastern. So please feel free to share that information with them as well. So now I'm going to hand it off to Brandy, SAFE Project's Executive Director, and she's going to kick it off today.
Hi, everybody, and welcome. Tracy, thank you for that introduction. Again, as Tracy mentioned, we did do our first big reveal for SAMHSA's Prevention Day. But prior to us going into the program, I just want to give you a little bit of background, but I think I'll start off with a little bit of humor. We all need humor in our life right now. So I just want to thank you all for giving me a reason to bathe, brush my teeth, and get dressed. I'm having a messy bun day, but I'm just going to go with the flow and keep it moving. So I really appreciate you all joining us. So just to give you a little bit of background on SAFE Project, SAFE Project was actually formed by the former Vice Chair of the Joint Chiefs of Staff, Admiral Winnefeld, and his wife, Mary Winnefeld, after losing their son, Jonathan, to an accidental opioid overdose back in 2017. Their first response to that, the Admiral being having the military background that he does, really wanted to make sure that other family members and individuals do not suffer or go through this same pain that they went through. So during the time frame where they were waiting for Jonathan to be laid to rest in the Arlington Cemetery, they took that time to really take action. They didn't want to crawl into a ball. They wanted to make sure that that they were doing something productive. So SAFE Project was born. And through SAFE Project, the Admiral and his wife, Mary, thought about it, and they said, you know, there's not one specific approach to combating this opioid epidemic. It really takes a full village to do this. And because of that full village and the Admiral's engineering / military background, the 6 lines of operation were born. When I came into the organization, probably a little over a year ago, those 6 lines of operation, really there was an organic development of initiatives within those 6 lines of operation, because what we realized through that was that there are different stakeholder engagement opportunities for each line of operation. And within each line of operation, we're going to operate or operationalize. I use that word quite a bit. I love that word. We're going to operationalize these programs in different ways, and how we engage those stakeholders are going to be different throughout. So we came up, initially we had the safe campuses and safe communities. A little further into the development of the safe initiatives, we then brought on safe veterans. We are now in the process of working on safe workplaces, which we have not yet put into our nice little logical frame here, but we will, so that's going to be coming as well. But one of the key things that we have done is we've really made sure to target those lines of operation within law enforcement and criminal justice. As you can see, prescriptions and medical response. We have our family outreach and support, our full spectrum prevention, which encompasses this particular program, and then our treatment and recovery, as well as our public awareness. I'm really excited about this program. I will say that I'll probably dive a little deeper once we get into the slides, but I'm excited about this program because my direct experience and direct service within behavioral health has always been a cutoff when it came to the continuum of care between prevention and recovery. So coming into this organization, meeting Sarah Potter, us both having the same vision, passion for our community. I appreciate the fact that she's done a lot of the legwork in this, and we've brought it full circle, and here's the program in fruition. So for that, I will actually turn it over to Sarah Potter to start the process.
Hello, everyone. I am delighted to have you all on the phone, and sad that I can't see all your faces and talk to you one-on-one, but I think we're all used to the webinar world at this point. I will give a shout out though. This is our first call announcing the program. We have North Carolina, Florida, Utah, Virginia, Maryland, India, Tennessee, New Jersey, and that's it, represented. So I want to give a shout out to all of us who are here. So the big picture and some of the reasons that this program is being launched right now, and it makes sense, is we all have been through periods of time where there is a crisis that puts a spotlight on substance use disorders, prevention, treatment, and recovery. The most recent, prior to COVID, when we were writing this, was the opioid grants, the opioid problem, and then all the corresponding money that came down. Brandy mentioned our kind of 6 lines of operation. What we all know is in response to a crisis, quite often that is handled in various silos, and also quite often it really doesn't get to the underlying root causes. And so after being in this field for 25 years, kind of like Brandy, it's just time. In the opioid space, you saw a lot of money coming down. We saw a resurgence in recovery, which is fabulous. What history tells us, though, is when that money all goes away, the focus and some of the infrastructure that we have started to build begins to crumble. With COVID being now the most recent crisis that we're dealing with, I think all of us who are working on the ground in behavioral health already see that we have to do our work differently. We already are. That's going to continue. Coming from North Carolina, you know, we're used to hurricanes, and we all know you kind of have to weather the storm, which is what we're doing with COVID right now. But we also know that the surge is really what gets you. And so what we're doing right now with this program is preparing communities for the surge that we unfortunately know is coming and is already starting. In recovery and prevention, we've always been natural connectors in our communities. We've been connectors across various disciplines. It's part of who we are. It's part of what we do. And it's part of why we do our jobs well, is that we can make those connections. So we already do know how to do some of this work. In the challenging space that we're in, every period of time, it feels like I'm talking about what is the latest challenge. Before opioids, there was changing the system and integrating, you know, behavioral health with healthcare, and there's always changes and challenges. I think where we're at this moment in time, it's really important for all of us to think very clearly and to be very action oriented on getting at some of those root causes rather than just responding to the immediate situation, and to be really strategic about that. So this approach helps us. The question is, how do we remain relevant given all of this, both in prevention and in recovery supports? This is one of the ways that we do that through this program model. Go ahead. We can change, yeah. So lots of challenges that I just laid out. We all know that, you know, from crisis comes opportunity. We have had some lost opportunities in our fields, both prevention and recovery, because we've not capitalized or been able to kind of pick our heads up quick enough to respond fast enough in the ways that we needed to. And so this program gives us an opportunity to pick our heads up and get in there now when our communities really, really need us. We can go ahead. So what is this thing we keep talking about? Bridging Prevention and Recovery. It's a program, so it's a program model. SAFE Project has copyrighted and trademarked a new program model that is being evaluated as we speak. It's a program. The program manual is 100 pages long. So it's a program manual. It's also a new model for doing this work. And it's also a required training that goes along with it. So one of the things about really changing the way that we do our work as systems at the system level is that we really want to make sure that everyone is really supported in doing that, because every community is different. This is not business as usual. And so we want to make sure that everyone is trained to do this properly so that it's impactful, and you have support from, in this first cohort, Brandy and I directly, as you're going through doing the work. So there's that technical assistance built in along the way, and the training on how to do this work up front. Again, making sure that both prevention and recovery are starting at square one together in the same spot. Go ahead. So broadly across the field, we have a lot of common ground. Brandy, you want to talk about common ground?
Let's talk about common ground. And I'm seeing, I'm recognizing some of the people on the call, and Tiffany, you're nodding your head. You know what this common ground is. I mean, we have a lot of people in prevention on the call. We have a lot of people in recovery on the call. And the reality of it is, we're all doing this work in the same capacity, but obviously with different language. But ultimately, there's an end game, and that end game is to make sure that there are safe communities, recovering communities from all aspects of recovery, and preventive measures so that the next generation doesn't have to go through the same things that we've gone through. So I think the biggest one, the common ground that we have and that we tend to fight over quite a bit rather than coming together and uniting and sharing, is the inadequate funding to meet the needs of the community. We all know that the first question when we're building out programs or implementing new initiatives is, where's the money? Show me the money. How am I going to get the money? And quite often the barrier or the challenge to that is we're always searching for new funding when there's existing funding and overlapping efforts that we don't necessarily take into account where we could actually find funding. It's kind of like going to BJ's. You know you're going to need paper towels for an entire month, so rather than buying them for the entire month, we buy them week by week. What we don't realize is we're putting money into our gas. Time equals money. So we're spending extra money buying those paper towels every week when we could actually buy them in bulk. So it's really important for us, and that's a layman term of talking about that inadequate funding. The other one is focusing, one of the other common grounds is we focus on building community support and healthy environments. We do it this holistically already. We know that this work is being done out there. We're working side by side with prevention, but we're not intentional about it. And because we're not intentional about it, we tend to fall over each other or create these walls where we are not connecting. Another area is that we do call to serve groups or people that are vulnerable. We do it in all of our populations. Quite often in the recovery community, we can see the signs way before others see the symptoms. And in prevention, we're trying to do the same thing, especially when we hear it quite often on trauma and other areas of behavioral health where there are specific connections that we can make that we definitely don't make in those vulnerable populations. Another one is the social determinants of health. We surely both agree that decrease or recognizing the social determinants of health. Now, granted, in that particular language, that's more of a prevention language, but we have mirrored language in that in the recovery. Shared interest in making services available to everyone. We all want to do that. We all want to expand those services, both in prevention and recovery and within the continuum of care. Another area is changing the community norms and attitudes and behavior to reduce the stigma of substance use disorder and increase connection. One of the sayings that we always say is that connection is the opposite of addiction. But we also know that there was a lack of connection prior to us even getting involved or picking up a substance. So we know that there's a missing component there, and the prevention side knows that as well. Increasing healthy opportunities and social recovery support. I'm going to hold off on that one for a moment because I have a diagram on the next slide that I want to take a look at to show you what that looks like. Goals of empowering people to live healthy, productive lives. We see it quite a bit. I mean, we have our DEA 360, we have our drug-free community efforts, we have all these different efforts in prevention. But in the same respect, once we've taken out that substance from the recovery side, we're still left with self. And it's really about empowering others to live those healthy, productive lives. That's the outcome, that's the end game, either with or without substances. We both have the need for community level change, for work to be successful and sustainable. We hear it all the time in recovery. How do you track sustainability? How do you implement programs that are sustainable? How do you maintain a recovery lifestyle? The same can be translated for prevention. How do we make sure that we're sustaining so people are not picking up? How do we make sure that we're sustaining so that people aren't going through mental health crises? And if they are, where are the resources for that? And then finally, data is definitely key, and there is a shared challenge to get it. Tiffany, I go back to you again. We know darn right well that trying to collect that recovery data is not consistent across the board and pretty much not even there because we don't know how to do it. And in the same respect, prevention has a hard time. Could we even fathom connecting those two data points to follow people through these systems in some way, shape, or form to build a collective data baseline and outcomes. So I'm going to go to the next slide. And as I mentioned, increasing healthy opportunities and social recovery supports. I borrowed this from Tom Hill from National Council when he was presenting for us one day. And it really stuck with me in two ways. One is we're always presented with a continuum of care. And on the right-hand side, you'll see the prevention, harm reduction, treatment, and recovery support. But there's no connection between the recovery support and prevention. And that to me becomes an issue because it needs to be full circle. Not only are we trying to prevent overdoses or prevent reoccurrence or relapse, we're also trying to prevent our future generations from going through the same thing that we went through. And we know, and data shows, that someone that has a substance use disorder, there's a genetic component. There's also trials and tribulations within the recovery community when we have our children coming up and going through these same processes, and we're not really quite sure what to do. The one thing that we don't do is connect with the prevention people that do their work very well and figure out how to work collaboratively to move forward to create these healthy communities. And on the left-hand side, you'll see that diagram from Tom Hill for NatCom. You know, how do we change the forest? You cannot continue to put those trees in rotten soil. We need to change that forest. And we have our sanctuary, we have our culture of recovery, we have our community. Every part of our being and our environment works collaboratively and holistically through prevention and recovery. The one missing component is intentional collaboration. We've never done that before. And quite often in systems, we get our hands slapped if we do. And a lot of that hand slapping is built around the lack of funding. You don't use my money and I won't use your money. You need this cut, I need this cut. But if we would actually work collaboratively together, we could create that healthy community and start that healing process and that recovery process from whatever it may be. It may be substances, it may not be substances. Who knows? But as long as we're working together, we can uncover and reveal how to create healthy communities. So with that, I'll pass it back over to Sarah Potter.
So I'm going to talk a minute about the key approaches used in the program model and the community program. These are also, as much as they're key approaches, they are also core beliefs that are embedded throughout the whole program. The program aims at making systems change. So we all know who our funders are on the prevention side. We all know where, what the recovery side of the system looks like. A systems approach it's a specific approach for targeting really complex social problems. So there's a lot of research in this space. It's been used very successfully in the homelessness arena. It's been used in tobacco prevention and control as well. I think in our field, we typically don't operate first and foremost from a systems approach model because those systems are really hard and complex to get through. And our communities get really frustrated trying to dig through all those higher level pieces when they're tasked to work with their communities and to meet their needs right now. So this ultimately takes a systems approach. The prevention and recovery is the high leverage point for starting to turn, you see our gears here, starting to turn some of those wheels in those bigger systems. Go back. Change management is some of the pieces that we need to use in here. Quite honestly, both prevention and recovery have things that they have done to help promote this work. And we each have things that we've done that does not advance this work as well. And we have to recognize that change is difficult and address that. So that's built in throughout the program. Ultimately, the responsibility for building healthy communities falls equally both in prevention and recovery. On the prevention side, it's built literally into the strategies that they are funded to do, is create healthy communities. Recovery addresses that in different ways. Crossing boundaries is essential. I think at the community level, quite often we talk about collaboration and partnering. This goes beyond just collaboration and partnering. So it's very structured, purposeful partnerships, not just interacting and communicating. So that crossing boundaries piece is important. The place-based collective leadership. So this program was written very specifically to fit in a whole lot of funding streams. So it's not just built for fitting in all the prevention funding streams. It's not just built for fitting in all the recovery funding streams. There are others that we are not tapping into together. So it's built in that way, but it's not built to be reliant on funding. So that place-based leadership is really important. Unfortunately, we probably have all been in situations where a grant comes into a community and it's really great and we're doing really great things, and then the grant goes away and so does all the good work. So this is built in a way to sustain that work. Prevention and recovery are the pillars for the work. We'll talk about this a little bit more later, but it does require a very deliberate partnership between at a minimum one prevention person and one recovery person who are going to spearhead the work and commit to doing that. I think recognizing that the recovery community is always looking for strong allies. They have a lot of allies, but I think the recognition that prevention is the strongest ally for recovery, and it is a stable ally, is built throughout this program as well. Recovery has to be built into any community initiative, community coalitions specifically. We saw this in North Carolina for sure, but in other states as well, is that recovery is often at the table, but not at the table in the same way that perhaps other disciplines are. And so they had to have a seat. It has to be an equal partner in planning and figuring out what needs to happen in the community. And so that is something that we feel really strongly about and is built into this program as well. They're not invited as a guest, they are an equal partner. The community environments have to change from within. So the way that we built this program is not that we're coming into your community and saying, here guys, do this thing. It's that we're helping you use this to make it fit to get the change at the community level that is really responsive to the community environment. And so the application of this program and what you come out with on the other end is going to look different across all communities based on what that community is bought into, what they need, what's happening on the ground. So that community focus is really important as well. And then on prevention, in the prevention side, we work a whole lot on protective factors, things that build resilience and prevent substance use initiation. On the recovery side, there's recovery capital, and these are quite often very similar. There's individual recovery capital, there's community recovery capital, but that does not happen just automatically. It's not the luck of the draw. Recovery capital has to be built, and that's all of our responsibility. And then the other piece we brought in here is that advocacy is essential. At least on the prevention side, I think this piece specifically has always been a little bit touchy and maybe a little bit uncomfortable. We have got to be advocating for the people that we are working with and for our communities every step of the way. So that's not an afterthought after you're all done. That piece is built throughout the whole program model. If we're not talking about what we're doing and why it's important, then how do we expect anyone to know? Okay, done. So why is this program a big deal? I maybe should have changed that question, but it is a big deal. This program has been highly anticipated. We have been working on it for years. We have worked with a lot of our federal partners as well, who have also tried to launch something like this, but have not really been able to get through the operational pieces of it. So it's easy to talk about how prevention and recovery make sense together. It's pretty difficult to operationalize a step-by-step process that takes you from point A all the way through to the end. And so Safe Projects is the first one to lay out that process that all communities can use. And so that's why it's a big deal. It's been, we have been getting the question, when are you going to be done with this, for a really long time. I already mentioned that it fits across existing funding streams. It is widely applicable across prevention, intervention, treatment, and recovery. In terms of the funding sources, that's important. As I already mentioned, until now, this approach has been, in theory, this is a good idea, not step 1, step 2, step 3, follow this process, and we're going to help you get there. So we were the first one to kind of put that down on paper. There are lots of communities who are already prevention and recovery are working together. It's not necessarily in a way, though, that is planned and deliberate, and you're walking through a process together, and it's something you're committed to. Is not built in necessarily into the strategic plan of what's happening at the community level. It's happening because good people see what we do, which is this needs to be done, and they're stepping up to do that. This program also builds on the strength of both the prevention and the recovery field. I'm fortunate enough to have a professional background where I've been able to work in both fields and across the entire continuum in North Carolina, Illinois, and California. And there's a lot of strengths and a lot of good things happening in both prevention and recovery, but neither field is great at everything. And so the way that we built this out is to play off the strengths of prevention as a field and as a practice, as well as the strengths of recovery as a field and a practice, and to build it in that way that they're complementing each other. And those strengths, that's it. Go ahead. So this one is really about existing funding and work. I know many of us right now, especially with COVID, are trying to figure out how we're going to continue to get our work done. What are we doing next? How is this going to fit? Specifically, this program addresses access and availability. Ultimately, the community decides which focus it wants to take, but access and availability, both of substances and of services. It addresses policy work. We all know how important policy change is and how that can make or break our ability to help people who need help. We've seen lots of policy changes really quickly in response to COVID. We're going to continue to see those. So us working on the policy side is really important. The norms Brandy mentioned already, how we kind of look at substance use, how we look at use rates in general, acceptability, disapproval, if you're working with young people, and then stigma and how we're looking at people who really need help because of their health condition. Media messages, those are the ones that we all probably are most familiar with using already, but that is a component of this work as well. Working with special populations, we talked about the real need to focus right now on Brandy said social determinants of health, but there are other ways to do it. We know, or other labels for us to call it, we all know that when people are losing their jobs, they are going to use substances more, they're more likely to overdose, that exacerbates the problem. On the prevention side, we look at those things as well in terms of it impacts your overall outcome in your health overall. And then building the capacity of the community is one of the pieces. That is a specific strategy that's used in prevention. This falls squarely in there. And then parenting and mentoring programs as well. So I wanted to give you kind of a little bit of a context of where this work heads and where it goes and what it looks like and how it fits with some of the things that we are all doing in different ways anyway. Go ahead. So I feel like I'm talking about funding a lot, but gosh, some of the connections I wanted to make for you here is that if we're working with our recovery partners through a data-driven planning process, that lots of industries use a data-driven planning process. Prevention uses them. There's several different models for doing that. We lay out a data-driven planning process, which means we don't start with, hey, wouldn't this be a great idea? Let's figure out where we can put this. We start with looking at what actually needs to happen in our community, not even based on just our opinion, but what we can actually see, and looking deeper and asking those deeper questions. In doing that, we're opening ourselves up for opportunities to work in ways that we have not worked together before. I believe that is going to open us up to being able to access funding and support that we've not been able to access before. And then Save Project, of course, is your partner along the way. It's a very much a strategic partnership between prevention and recovery. It's a team, not just one person signing up from one agency. So it's a team approach. We have about half of the spots filled in the first cohort already. And today is our first announcement of it officially. In some of those cases, we've had to help identify who your prevention partner is, or who your recovery partner is in your area. So we are able to help you. We have a national network. We work across all 50 states. And so it's pretty unlikely that we're not able to help facilitate those connections for you. And so I wanted to open that up and let you guys know that too. If you're in prevention, you're not sure where to find your recovery person, or vice versa, we can help you do that. Go ahead. Oh, what can I expect? Some of these things we talked about a little bit already, but if you become part and you're inaugurated into the initial cohort, you can expect to use, first of all of the core beliefs that I talked about already. You can expect to take a very specific approach to the area that you are working on. So this cohort is for people who are actually doing the work, not thinking about doing the work, or wanting to learn more about the field. It's an applied process that is very specific to your community or your area that you're working in. You can expect to learn what the strengths are of each field, and then learn how to use those collective strengths in a unified way, responding specifically to your community needs. The high leverage point for the system work between prevention and recovery, the way that we walk you through this process ends with raising up something that your community does not have, or maybe building something in a different way than it exists right now. So there's something very tangible and actionable that will come out of this. It's not a theoretical planning process where we think about how we might work together. You should expect to launch something when we are done with this. Hopefully being able to figure out where the funding comes for that if that's necessary. You can expect to receive very action-oriented training, as I said, and technical assistance. The inaugural cohort will have Brandy and I specifically doing that training and technical assistance, so you can expect that. And expect to receive all of the support that you need to have the skills to do this work going forward and throughout the process. So we're very mindful of, you can't expect people to be able to do things if they don't necessarily have the skills to do things differently. So that's what some of that learning is about. Go ahead. So we talked about who it's for prevention and recovery. Let me be a little more specific. On the prevention side, it's for those substance abuse prevention professionals who are working in the community already. Your community-based organizations who have prevention services also have staff that run those. It's for your coalition leaders who are working in coalitions that are addressing substance use. It is for public health professionals who are working on the social determinants of health. There's public health exists in every arena. They also have coalitions working on these issues as well. And then there's also a really nice fit for this approach in university and college health and wellness staff. That's a real natural fit. Some of that work is happening very deliberately in the university space. Quite often, your prevention person is also your recovery person. And so we put them in there on the prevention side because this is a nice fit for them as well. When we were writing this program, it's a community program. In our minds, when we were writing it, we really were thinking about high school and young adult ages quite specifically, because that's a place where we really can make a big difference and turn the tide by working together. So that's another reason that university level is targeted specifically. Brandy, you want to talk about recovery?
I absolutely do. So, and on the recovery side, as Sarah had mentioned, one of the key components that we have here is that we can identify both the prevention side and the recovery side should a community fall short or want to do this and know that it's necessary. So some of the areas that we'll tap into, if you don't know them already, are your recovery champions. Quite often they can be silent recovery champions, but they can also be loud recovery champions. In the recovery community, we call that little A and big A, little advocacy and big advocacy. So we can identify those in the field, and our recovery professionals. You'll hear recovery professionals in all different aspects, whether they're recovery coaches, peer recovery specialists, certified peer recovery specialists, and then also within our recovery focused community coalitions or task forces, we're finding that the recovery community and its profession is growing exponentially. So tapping into those recovery resources from the community standpoint, such as recovery community organizations. Obviously, as Sarah mentioned, the collegiate recovery programs, there are CRPs that are expanding throughout the nation, who are always looking for something to do in some way to be of service. So we can tap into them on the college campuses, and we are going to be expanding those collegiate recovery programs on community college campuses, as well as trade and technical schools. So there is another area. And then you have your public health professionals who employ recovery support services. Typically, that is in your emergency room departments. You may have them in your health departments, and they're paid or may just even volunteer to provide recovery support services. Before we go on to, just on the recovery community side, I just wanted to tap into to just make you aware of the fact that we do talk quite a bit about funding, because that is the overarching question. How are we going to fund this? What's in it for me? And I think it's really important for us to understand too that we have a couple different funding streams out there that this particular training will set you up for, to go after those grants, to go after those funding opportunities. A few that just come off from the top of my head are the ORN, the Opioid Response Network, or SOAR, the state opioid response, or even philanthropic grant opportunities when you're building coalitions. Quite often they're looking for innovation and creativity, and this gives you the platform and foundation to apply for those grants and something different and new in your community. And then there's also the B Corps, which is the Building Communities of Recovery grant. So they're all little tidbits that you could tap into, and it's really talking to your recovery community champions, figuring out what funding is there, what funding is appropriate. And then you could also talk to your single state agencies, because there's funding out there in all aspects of recovery and prevention to leverage this and build this up and build the capacity, coalition capacity building within your communities. So Sarah, I'll turn it back over to you.
We can go ahead, Tracy, to the next slide. So this is the save the date. The inaugural cohort learning lessons begin May 28th that is a series. So you see May 28th, June 11th, the June 25th, and then it goes into July. That gets us through the program and through the work of the program for which you'll be supported. If you're inaugurated into the initial cohort, as I mentioned, about half of the spots are full, but we still have openings right now. You can expect to work directly with Brandy and I on this. So save those dates. The website is on the bottom of the page. I suspect you all have gotten that already if you're on the call. The way that you reserve a spot is to go into that page. You will see a register now. Go in there, fill out the information. You will probably get a call from me just to make sure you have your good partner by your side, or to see if you need any support in doing that. And it's as easy as that. And so I think we have some time now. We have a few minutes for questions.
Yeah, I haven't seen any questions come in the chat, but I'm gonna unmute everyone. And if you have any questions for Brandy or Sarah, please feel free to ask.
We were so clear that there is absolutely no other question that anyone might possibly have, I guess.
I have a question.
Hi, Amy.
Hey guys. So, so Sarah and Brandy, you guys both know me. So I'll talk to, to UNCG about this, the Collegiate Recovery Program, and then also Jim, would talk it out. But if neither of them want to or are able to get involved, is there any way or capacity that I could still get involved with somebody else, with another group? Because this, I'm brand new to all of this, and would love to participate. But if they're not on board, is there any other option?
Yeah, so I can help you figure out, Amy, what hat you would be wearing. I know you wear lots of hats too, like most of us do in this field. We can talk offline, and I can figure out kind of which hat is going to be the best one for you to wear, and then we'll go from there to make sure that we have that partnership. Sound good?
Wonderful, thanks. Yes, thank you so much.
Any other questions?
Tiffany, I see you at my bottom of my screen now. I could only see a few people when we started. I see you now.
Hi.
Hey, if you're available after the call, I want to just have a quick 5-minute hello chat.
Oh, no problem. Sure.
Yeah,
I love it. I'm excited about everything just moving forward. I've been waiting. I didn't send emails or anything. I just figured it was in the process of happening. So I'm excited to see it roll out. There's a huge gap in between prevention and services. So I'm just really, really excited to see it roll out.
Mm-hmm. Yep.
I'm just excited to see your face.
Yeah, right?
A Maryland girl right there.
Hey, that's what I do. That's what we do. Just trying to make it happen,
Yep.
Just trying to make it happen. As soon as I seen it pop up, I was just on it. Yeah, so great. And I just want to mention that you guys were great with timing, by the way.
Thank you.
Locked in at hour.
Hey, Sarah, I just had one quick question. On the recovery side in particular, I'm thinking, there might be individuals, maybe not with a lot of, formal training or background on this, but maybe with a lot of lived experience that might want to do this. is that something you're picturing? Or are you picturing more, people with, some experience in behavioral health, or at least serving in some kind of recovery community organization or collegiate recovery program?
Yeah. I think it's not as much about their background as it is their commitment to doing the work. So, I mentioned that there are some coalitions who have already managed to do this. It's not necessarily that there's someone that's paid on the recovery side that's paid to sit in that seat. It's that there's someone that's committed to be working with that group. So my way of saying yes to that is that it's really about their commitment to seeing through more than it is to who is paying them to be there. Does that make sense?
Yeah, no, that's helpful. Thank you. It gives me some more ideas.
Okay. Any other questions? We have 10 minutes. We could play a web charade game or something. I joke about that, but I actually was on one of those this morning.
I did a Jeopardy with my family like last week.
Oh, did you?
Yeah, it was pretty cool.
Yeah, we did a little bit of that on staff time.
Yeah.
Hey, so I was wondering, have you so you've talked about a lot of the theory and the program and how, things would be kind of approached and implemented. Have you guys, is there any, example, and I, and I understand at this point it would be, probably theoretical, but you actually just said, a lot of people have managed to, to kind of bridge the gap already. So, because I'm so new to this and you don't know a lot about what's going on and what's out there, what's worked and hasn't worked, do you have an example of what this would look like in the real world, in application?
Sure. If you go on the webpage, you'll go to the bottom, the blog on there that we did a little while ago. It's actually about an area in North specifically. That's a good example to show what this work comes out like on the other side. But again,
beautiful.
It really does depend on the area. So what they did was what their community needed. What your area, Amy, needs and where you're working might look completely different.
Sure. Okay, thanks.
All right. Well, if there's no other questions, I wanted to just wrap up for the day and just thank you all for joining us, and thanks to Brandy and to Sarah as well. We're really excited about this program and excited to launch the first cohort. As a reminder, spaces are limited and they're already filling up, which is awesome. And so just hop onto that website, and there's a button down at the bottom where you can indicate that you're ready to sign up, and you'll hear from Safe Project staff as soon as that gets submitted as well. So thank you all again for your attention and your interest in the program. If you have any questions that kind of come up afterwards, feel free to reach out to us. And I hope you enjoy the rest of your day.
Me too.
Great. Bye,
Thanks,
everybody.
everybody.
Bye.
Bye.
You want to stay on here? You want to get offline, or you want to stop recording? What would you like to do?